All right, so we are going to go through a strategy I've been using for a while. Now, today is Monday. So Wednesday, I have a clinical skills practical. So I need to memorize three lists. One is knee aspiration, one is nail trephination, and then the actually four kind of female and male straight calf. The strategy I use is the memory palace. Basically, what I've done is I've gone through my apartment and you can see here like door, trash can, Arlo, that's my dog, basket, the counter slash car keys, stovetop, microwave. I've walked around my entire apartment and basically have selected like 200 items. And what I do is I take a list that I need to memorize and it works perfectly because each bullet is a point that I can score, right? So each point, each bullet worth scoring, I drop in one of these locations. Then when I get into the actual practical, I just mentally walk through my apartment and all that information is there. Sounds insane. I've used it now 4 times. So I've used it for 2 separate practicals using the same exact memory palace, and they worked out really well. I did really well on them, and it really doesn't take a long time. So I'm going to walk you through this and show you how to memorize a list of this one's not terrible. So this is like 32 things, but we should be able to knock this out pretty quickly. So what I've done was I've gone to the Excel spreadsheet that has this actual checklist that I'll be graded off of, and I've kind of typed it my own way into this info column here and matched it up with things around my house. When I built this memory palace initially, I like to do everything in groups of 5, and then I'm going to memorize these in groups of 5 because then you can kind of feel when you're missing something. You know, it's 2 and then a middle, and then there's 2 at the end. So let me just go through it just so you kind of know what I'm talking about here. So diagnosing and managing a large joint effusion. So I'm going to make like a little mnemonic little story for all of these. Over time, these little stories and mnemonics fade away. I like to think of them as like scaffolding. So they'll fade away, and then all I have to do is think about the location, and the information that I left there is going to be there. So let's say I'm taking slash fixing the door, like joint, like hinge. So I'm just managing a large joint effusion. All right, contraindications here. So in the trash can. So the other thing that I try to do is find little connections. So these just spell ABC, which is pretty easy. So allergy to anesthetic. I don't know. I open up the trash can and I sneeze like allergies, even though that's not the same thing. Like an allergy. I see a bunch of bacteria crawling at the bottom. So bacteremia, and then cellulitis. Um, I don't know. I put it on my head like a lamp shade, light cellulite, light lamp shade. And they spell ABC, so that should be pretty easy. And then my dog's basket where I have like his poop bags and stuff. I kind of just remember that that's allergies because the other checklists all are in the same order initially. But I'll say my dog's allergy medicine is in here. This spot is normally for a tetanus vaccine, which we don't need to ask for that one. I'm going to keep it there and just skip over it. So in my upper cabinet, I always picture like my driver's license up there, which is the name and date of birth. Okay, when I do my first 5, I will look away and then I will just recall everything that I just did. So the first thing is that, we're going to be managing a large joint effusion. Contraindications for what we're doing today are allergies, bacteremia, and cellulitis. And I try to picture that little story that I made as well as I'm going through this. Do you have any allergies? Skip tetanus, and then confirm your name and date of birth for me. All right, and then I'll just do a really quick audit to make sure I got everything correctly, and then I'll just kind of move on. So next would be my oven. So this would just be me explaining this in layman's terms. I kind of just remember that because, again, the initial order is the same. Complications here. Okay, so allergy to anesthetic. let's say, I don't know, what's something people are allergic to? Let's say I'm cooking nuts on the back left burner. I'm cooking like and this again is ABC, like a bloody steak on the upper left burner, and then cartilage trauma, and then there's a Hot Wheels car driving around the rim of a pan on the upper right burner. Okay, then we move up to the microwave alternatives, oral pain control and topical pain control. So we'll just put a, bottle of Tylenol in here, sparking. Sometimes I give things like a little bit of an extra, action, something that'll pop out, make it memorable. So bottle of Tylenol in here, sparking. I put out the fire with topical pain cream. And connecting two things together is always going to be helpful too. Then we get above my microwave to the upper cabinets. So risk to these alternatives. So persistent pain or persistent infection. So I don't know, like a wet painted purse on the left. So persistent pain, and then infection. I don't know, some old food I left over in another purse. That's all infected. All right, medicine cabinet. Any questions? So that's going to be, I usually think of like the long receipt they give you when you go to the pharmacy of like all the different questions you could ask. Okay, so now I'm going to start from the beginning here. So our management here is going to be for a large joint effusion. Contraindications here would be an allergy to the local anesthetic, bacteremia, or cellulitis. Do you have any allergies? Confirm your name, date of birth for me. So then I would explain the procedure in layman's terms. We're going to numb you up a little bit. We're going to aspirate some fluid. We're going to put in some steroids and some anesthetic, and then we'll bandage you up, give you some patient education. Complications of what we're doing today would be, the A was nut. So you could be allergic to the local anesthetic. There could be bleeding within the joint, and then there could be damage to the cartilage. Things we could do, some alternatives here would be oral or topical pain medication. Contraindications or complications to those alternatives would be persistent pain or persistent infection. Okay. Oh, and then any questions? All right, so there we go. So moving on, and then, all right, so now we're moving on to the top of my refrigerator, which I always picture like a Judge Judy thing, and she's like yelling at people for not obtaining consent. So Judge Judy trial. Freezer, I always think of like putting on like goggles, like I'm skiing down a mountain. Ski down mountain, so PPE. Fridge, Mayo, the Mayo station. So that's how you spell mayonnaise. Main trash can is usually for draping. We don't need to do that. So we're going to skip this here. And then my little Ninja cooker is usually where I would, not usually, but it's like medication, confirming medication. We'll get to new stuff in a second. So this is kind of easier because I've, a lot of the checklists kind of start the same way. Confirm medications. All right. So even though that one's kind of easy, we'll run that through again, just to kind of show you the process. So we're going to manage a large joint effusion. Complications of that or contraindications of that would be allergy to the local anesthetic, bacteremia, or cellulitis. Do you have any allergies? Can you confirm your name and date of birth for me? Layman's terms, complications of this would be allergy to the local anesthetic, bleeding in the joint space, and damage to the cartilage. We could also do oral pain med, or we could do topical pain med. Complications of that alternative would be persistent pain or persistent infection. Do you have any questions for me? Do I have your consent? Going to make sure I have my PPE on. going to make sure my Mayo station is set up, and I'm going to check the contents, expiration, and lot number of my meds. All right, so we're 15 in. So, all right, so now we're in my kitchen. The upper left cabinet is going to be me actually making my cocktail. So I'm going to say there's cocktail mix up there. And that's just a reminder. I don't actually have to like say anything. It's just my reminder of like, oh, okay, I need to actually do this now. Middle cabinet position supine with knee bent 30 degrees. So I can kind of picture the knee I'm going to be doing this on. So open up the cabinet and a knee falls out and hits me in the face. 30 degrees. So I need to remember that. So I've converted all of my numbers to other things. I don't know if I remember 30. 30th president is Calvin Coolidge. So I do this thing where anything from like 1 to 45, whatever we're on now, I convert to that president to remember the number. Sounds insane, works great though. So Coolidge will say, like a cool fan is blowing. So that's 30. So we have to do that 30 degrees. Because you could think like 45, right? Knowing that number specifically is important here. So we'll see if that works in a second. Okay, upper right cabinet. Geez, so we have to palpate for 4 things. This will just be rote memory. There's, I can't make mnemonics for this, but it's the patella itself, it's the patellar tendon and ligament, the tibial plateau below that, and then the femoral condyle. But I do just need to remember that I'm palpating things. So I'll say, a bunch of a bunch of patella fall out into my Ninja cooker, which is right below that. All right, paper towel area, prep skin with chlorhexidine. So we'll say there's like, instead of, we'll say there's like Clorox wipes where my paper towels are. Oops, Clorox wipes for paper towels. And then use ethyl chloride to anesthetize, sink under sink. So that's cold. So I'm just going to run cold water over the knee. Really cool when it works out like that. And that's ethyl chloride. All right, so our indication today is to manage a joint infusion. Contraindications would be allergy to the local anesthetic, bacteremia, and cellulitis. Do you have any allergies? Confirm your name and date of birth for me. Layman's terms, complications of this would be allergy to the local anesthetic, blood in the joint space, damage to the cartilage. We could do topical or oral pain meds, but that you can get persistent pain, persistent infection. Do you have any questions? Do I have your consent? PPE, Mayo Station, use my, look at my medication, lot number, expiration date, contents. Moving on to the upper left. So I'm going to make my cocktail at this time. I'm going to go ahead and put my knee to 30 degrees. And that's going to be in, while the patient is supine, 30 degrees. I'm going to palpate for the patella, the patellar ligament / tendon, the tibial plateau, and the femoral condyle. I'm going to prep with chlorhexidine, and then I'm going to anesthetize with ethyl chloride. I got those right. Yes, good. All right, we're 20 in. We're well over halfway, actually. Okay, now we're moving on to my closet. So the top of the closet, so do my actual aspiration. I don't know. I'll just put the knee. Knee is on top, and I aspirate it. Closet trash can below that. Send aspirate for, okay, so now I need to send this for 3 different things. So this will be handy here. So appearance and cell count to aid in diagnosis. So I'm going to, I take a magnifying glass and look at the appearance of the cells in the trash can. And then I count them. Kind of like a Mario Party game where you have to count things. Cool. Culture to see infection. So now this is the top of this like shoe rack thing I have. So we're sending the bacterial culture out. We'll just say like, there's a bunch of, bacterial cultures up here. Gram positive, gram negative, atypical, et cetera. Mid-rack crystal analysis for gout or CPPD, so pseudo gout. We'll say, I don't know, like the crystals from Crash Bandicoot are hanging from the hooks. Do your actual technique, put it in the cocktail, withdraw and hold pressure. Okay, so this is your reminder for me to actually do the procedure and that to make sure I hold pressure. So we'll say, I'll probably just remember that at that point, but I want to make sure I hold pressure after I withdraw. So I take a shoe off of the rack and it springs a leak. So I apply pressure. Okay, so our indication today is managing a joint effusion. Contraindications here would be allergy to the anesthetic, bacteremia, and cellulitis. Do you have any allergies? Confirm your name and date of birth. Layman's terms. Complications here would be allergy to the local anesthetic, blood in the joint space, damage to the cartilage. We could do oral or topical medication. Persistent pain or persistent infection would be complications of that alternative. Do you have any questions? Do I have your consent to proceed? Put on the PPE, Mayo Station setup, medication, expiration, lot number, and date. Mix my cocktail, which I should actually talk through what I actually have to do here. So it's going to be equal parts lidocaine, and then there is a steroid as well. I'm going to do the lidocaine first, make sure my air is out, all that proper procedure there. Then I'm going to go ahead and make sure the knee is at 30 degrees. I'm going to then palpate for the patellar tendon / ligament, the femoral condyle, and then the tibial plateau. I'm going to then prep the site with chlorhexidine. I'm going to anesthetize with ethyl chloride. I'm going to go ahead and do my aspiration. Things I'll be looking for when we send this out are going to be the cell appearance and cell count. We're going to send it off for cultures, and then we're going to check for crystals for gout or for pseudo gout. So that's 1, 2, 3, 4. And then the fifth thing is, after I finish all of that, I'm just going to apply pressure. Okay, almost done. Next is my is dog food, so doing okay. My patient was falling into the dog food like quicksand. So I bailed him out or her. Ask how they are doing. So I have a calendar. So we'll say, I put a bandage over my calendar to patch it up. Wash with warm soapy water. So I have a thermostat. So let's say my thermostat is all muddy and dirty. So I wash it with warm soapy water. My bass guitar is next. Anesthetic will wear off in 1 to 2 hours. So we'll say 2 of the strings fell off. So I just have like 1 to 2 strings. So 1 or 2 strings left on my bass guitar. This has repeated itself, so this is a pretty easy one. So anesthetic wears off. Maybe the strings hurt my fingers. Tylenol for pain control. This is going to be my TV. We'll say there's a Tylenol commercial on. And then I'll just finish off these other 2. Fever, pain, redness. These are just red flags. So we'll say I get the red ring of death on the Xbox. So say my red flags, and then come back in 3 to 5 days. So this will be my bookshelf that's next to it. So my code for 3 is like Adam Sandler. So I'm going to say there's a DVD of 50 First Dates. And I'll just kind of remember the 5. 51st dates. So that's 3. So 3 to 5 days. All right, so let's do the entire thing here. So my indication today is going to be managing a large joint effusion. Contraindications would be allergy to the anesthetic, bacteremia, or cellulitis. Do you have any allergies? Confirm your name and date of birth for me. Layman's terms, this is what we're going to do. Going to take out some fluid, going to put in a anesthetic and some steroid, going to use some patient education, going to send it off for cultures, etc. Okay. Some complications of what we're doing today would be allergy to the local anesthetic, blood in the joint space, damage to the cartilage. We can give you a oral or a topical pain medication as an alternative, but you can get persistent pain, persistent infection. Do you have any questions for me? Do I have your consent to proceed? PPE, Mayo Station, medication, lot number, expiration, contents. I'm going to mix up my cocktail at that time, 50-50 lidocaine first, make sure the knee is at 30 degrees. My patient is supine, patella, patellar ligament tendon, tibial plateau, femoral condyle. Going to prep the site with chlorhexidine, run it under cold water. I'm going to use ethyl chloride to anesthetize. I'm going to go ahead and do my actual aspiration. 3 reasons why we're doing this, we're sending the fluid out. 1 is to look at the appearance and cell count. 2 is to run it for cultures. And then 3 is going to be to look for crystals for gout or for pseudogout, CPPD. And after I'm done all of that, I'm going to make sure I apply pressure. I'm going to make sure my patient is doing okay. Are you doing okay? Which hopefully I would remember to do that earlier as well. Doing okay. Going to bandage the site. The pain meds are going to wear off in about 1 to 2 hours. It's a little out of order. You can wash this with warm soapy water. You can use Tylenol for the pain. Red. So pain, infection, fever, redness, swelling, anything like that is a red flag. Give us a call. Come back in 3 to 5 days. I think that was the last one. I would make sure I document appropriately. If you have any questions for me, wash my hands, take my gloves off. There we go. So I'm done. So just one more, just make sure I got everything and didn't like mess anything up as I was going. No, that's it. That's it. So that didn't take long. And it might, I didn't use like this Mario Party, I added in extra stuff. It just helps me remember. You might think it's a waste of time. It works. So it's, a 32 item list or a little less, completely done. Here's the key, right? In exactly an hour, I'm going to recall this list again. So I'm going to set a timer on my watch, recall this all in an hour. Most importantly, tomorrow morning, first thing tomorrow morning after a full night's sleep, I will repeat it one more time. That ensures I'm not going to forget this on Wednesday. And I'll probably do it one more time like the day of in front of somebody. But this is my strategy. It's been working well all semester. It works wonders. I already have my next one geared up. So, I get into my laundry room, I get into my bathroom, bidets, treadmills, windows. I use everything in my apartment. It works really well. But the key here is I've invested some time in this right now, right? Just as my brain is like cleaning itself and being like, do you really need to remember that? I hit it again in an hour and it'll take 45 seconds to run through it, right? Then after tomorrow morning, as again, my brain is going through all this information, cleaning out things I don't know, I hit it again. And then it's like, okay, we really need to remember this. You're bringing this up yet again. And then I don't have to keep repeating it. I don't have to keep going through it. And that's it. So, all right. So I'll call it here and try it for yourself. Once you do it, you will use this strategy a lot, I promise.